You've probably asked yourself this exact question. What's the best blood pressure for older adults? And every time you go looking, the answer seems to change. Your doctor says one thing, the evening news says another, your neighbor swears by a third. So here's the real truth, and I'll give it to you straight in the next 15 seconds. As of 2025, the official target for most adults is under 130/80. But for older adults specifically, that number comes with a catch almost nobody explains. And getting that catch wrong is how careful, sensible people end up overtreated, dizzy, and falling. Stay with me. By the end, you'll know not just the number, but your number. I've spent years reading the blood pressure research and sitting with the guidelines that doctors actually use, and translating them into plain English for people who don't have a medical degree and shouldn't need one. Here's why this matters for you right now. If you're somewhere between 55 and 70, there's a good chance you're already taking a blood pressure pill, maybe two. You check your numbers at home or at that machine by the pharmacy, and you've probably had the unsettling experience of being told your normal suddenly isn't normal anymore. That's not you imagining things. The official targets really did change, most recently in 2025. Quick, important note, and I'll only say it once. This is educational content, not medical advice. Nothing here is a reason to change or stop a medication on your own. If anything I say sounds like your situation, that's a conversation for your own doctor, who knows your history. I don't. Here's the open loop I want you to hold on to. There's a number that sounds healthy, almost impressively low, that for some older adults is actually a warning sign, not a gold star. I'll come back to which number and why in a few minutes. Before the 5 truths, let's clear up the confusion itself, because the confusion is real and it's not your fault. For decades, the rule of thumb was simple. 120/80 was normal. Anything around 140/90 got you the high blood pressure label and probably a pill. Quick refresher on those two numbers because they matter for the whole video. The top number, systolic, is the pressure when your heart squeezes and pushes blood out. Think of it as the push. The bottom number, diastolic, is the pressure when your heart relaxes between beats. Think of it as the rest. Then in 2017, American guidelines moved the line. They lowered the threshold for high blood pressure from 140 down to 130/80, which overnight turned millions of people who felt perfectly fine into people with hypertension. The 2017 guideline moved the target threshold from under 140/90 down to under 130/80 for most adults. And in 2025, the newest American guideline looked at all the latest evidence and kept that lower target, under 130/80, and even nudged toward going lower still if your body tolerates it. The updated 2025 guideline reaffirmed a target of under 130/80 for most adults. So that's the headline. But headlines leave things out, and what they leave out is exactly what older adults need to hear. Let's get into it. So, truth number 1, if you learned years ago that 140/90 was your line in the sand, that information is now out of date. The current target most doctors are working toward for the general adult population is under 130/80, and the reason isn't arbitrary. Over many large studies, every step down in the top number lined up with meaningfully less risk of the things we're all trying to avoid: stroke, heart failure, heart attack. Research found that for every 10-point reduction in systolic blood pressure, people experienced reduced risk of stroke, heart failure, coronary heart disease, and overall death. The big study that pushed this thinking is one you may have heard of. It's usually called SPRINT. In broad terms, it compared aiming for a top number under 140 versus aiming under 120, and the tighter target came out ahead for preventing heart problems. There's even evidence the 2025 guideline points to that keeping blood pressure controlled may help protect the brain over time, lowering the risk of cognitive decline. The 2025 guideline recommends treating to a target of under 130, partly to help prevent cognitive decline and dementia. So far, this all points one direction: lower, lower, lower. And if I stopped the video here, you'd walk away thinking your only job is to get that top number as small as possible. That would be a mistake. And it's the single most common mistake I see careful people make with this topic. Here's your first action, and it's simple. Find out what your most recent readings actually are, not what they were 5 years ago. If you have a home cuff, take 3 readings this week, same time each morning, sitting quietly for 5 minutes first. Write them down, we'll use them later. And one more thing before we move on. I'm curious, what's your top number lately? And has the right target ever been moved on you the way we just described? Tell me in the comments and tell me where you're watching from. I read them. Transition. Because here's where the story turns. That word lower, it has a hidden floor, and falling through it is more dangerous than most people realize. Remember that open loop, the number that sounds healthy but can be a warning sign? Here it is. For older adults, blood pressure can be too low, especially when it's medication pushing it down. And too low brings its own set of problems. This is the part the headlines almost never explain. Researchers describe it as a kind of U-shape. Picture a valley. On the left side, blood pressure that's too high, that raises risk. We all know that part. But climb up the right side of the valley, where the pressure is pushed too low, and the risk starts climbing again. The safest place is the bottom of the valley, not the far edge. What does too low actually do to an older body? A few things. When you stand up, your blood pressure has to adjust in a heartbeat to keep blood flowing up to your brain. As we age, that reflex gets slower. Add a strong dose of blood pressure medication, and the pressure can drop too far when you rise from a chair or get out of bed. The result is that lightheaded, room-tilting moment when you stand. Doctors call it a postural drop. You probably just call it getting dizzy when I get up too fast. And here's why that matters so much. That dizziness is one of the leading roads to a fall. And for someone over 65, a fall isn't a minor thing. A broken hip can change the whole shape of a person's life. So the irony is sharp. A medication meant to protect your heart, pushed too aggressively, can lead to an injury that's just as serious. Here's the genuinely counterintuitive part. The thing you can't easily get elsewhere. The big studies that gave us AIM under 130 largely studied healthier, more robust people and left out the frailest older adults. The most recent guidelines openly admit this. The major trials behind intensive blood pressure lowering largely excluded frail or institutionalized individuals. And guidelines acknowledge this by recommending individualized care for those groups. So when someone takes under 130 is best and applies it like a law of physics to every older person, they're stretching the evidence past where it actually goes. Lower is better until it isn't. That's truth number 2. Your action here. If you ever feel dizzy, lightheaded, or unsteady when you stand up, do not shrug it off, and please do not adjust your own pills. Write down when it happens and what your reading was, and bring that note to your doctor. That single observation can change what they recommend for you. Transition. Which raises the obvious question. If the number isn't one size fits all, then what decides your number? It's not your age. It's something else entirely. If this is useful so far, and I hope the floor idea especially lands, then subscribing is the easiest way to support the channel and helps me keep making these for people who want the real picture, not the headline version. That's the only time I'll ask. Now, back to it. Back to what actually decides your number. Picture 2 people. Both are 78. One still gardens, walks 2 miles, carries her own groceries up the stairs, takes no pills, or maybe one. The other has slowed down a lot, takes 6 different medications, has lost some weight without trying, and feels wobbly on his feet. Same birthday, completely different bodies. And here's truth number 3. They should almost certainly not be aiming for the same blood pressure. The word the experts use is frailty. It just means how much reserve your body has, how well it bounces back from stress, illness, or a hard week. It's not about age on paper. It's about resilience. For a robust older adult, active, few medications, steady on their feet. Aiming for that tighter target around 130 usually makes good sense, and the evidence supports it. For a frail older adult, many medications, unsteady, recovering from illness, the math changes. The benefit of squeezing that number down shrinks, and the risk of harm from overtreatment grows. So the modern guidelines do something smart. They stop giving the frailest patients a single rigid number and instead say, in effect, make this personal. The 2025 guideline recommends individualized targets for older or frail patients to balance safety and benefit, with exceptions for those who are institutionalized or have limited life expectancy. And this is where the rest of the world is interesting. European guidelines lean even more flexible for the oldest and frailest. One major European body suggests a target range closer to 130 to 139 for adults in their late 60s and 70s, and even 140 to 150 for those 80 and older or who are frail, if that's what their body tolerates best. European guidance recommends a target range of 130 to 139 for adults aged 65 to 79, and 140 to 150 for those 80 or older or frail. I want to be careful here, because this is exactly the kind of thing that gets misheard. I am not telling you a higher number is fine, or that you should ease off your treatment. I'm telling you that the right target is a conversation, and that conversation should include an honest look at how robust or frail your body actually is, not just the year on your birth certificate. Now, you might disagree with me on this one. Maybe your doctor has given you a firm number and a firm reason, and it's working. If so, I genuinely want to hear it. Tell me below what target your doctor set and why. These comments teach me, and they teach everyone else watching. Your action. At your next visit, ask one specific question. Given my overall health and the other medications I'm on, what's the right blood pressure target for me, personally? That word, personally, changes the whole conversation. Transition. But all of this assumes the number you're working from is even accurate. And that's a bigger if than you'd think. Truth number 4. The reading taken in those few rushed minutes at the doctor's office may not be your true blood pressure at all. You know the scene. You hurried to make the appointment. You sat in a cold waiting room reading a magazine about somebody's diet. A nurse wraps the cuff while you're mid-sentence, takes one reading, and writes it down. Of course it's high. You're not relaxed. You're at the doctor. This is so common it has a name. The white coat effect. Blood pressure that spikes simply from being in a medical setting. It's real, and it can make a perfectly well-controlled person look like they need more medication than they do. There's an opposite trap too, and it's sneakier. Some people read normal at the office but run high at home, in real life. That one hides a genuine problem behind a falsely reassuring number. So, how do you find the truth? The newest guidelines are clear on this. The most reliable picture comes from readings taken outside the doctor's office, at home, over time. The 2025 guideline recommends confirming a suspected diagnosis using out-of-office measurements, either home monitoring or 24-hour monitoring. One nervous reading in a paper gown is a snapshot. A week of calm morning readings at your kitchen table is the actual movie. Medscape. Here's the principle that ties truth number 4 together, and it's the one I'd tattoo on the inside of every home cuff if I could. The trend matters more than any single number. One high reading after you climbed the stairs and argued with the parking app means very little. A steady pattern over 2 weeks means everything. Your action. And this is the most useful 5 minutes you'll spend this month. For 1 week, take your blood pressure at home twice a day. Once in the morning before pills and coffee, once in the evening. Sit quietly for 5 minutes first, feet flat, arms supported at heart level. Write each one down. Bring that page to your doctor. You'll be handing them better information than a single office reading ever could. Quick question before our last truth. Of everything so far, the lower target, the hidden floor, frailty over age, or the office reading fibbing, which one surprised you most? Just drop the number. 1, 2, 3, or 4. I read every single one, and the answers genuinely shape what I cover next. Truth number 5, and it's the one that gives you the most control. How you reach a healthy number matters as much as the number itself. Two people can both land at 128/78. One got there mostly through daily walks, less salt, better sleep, and one well-chosen medication. The other got there by stacking on pill after pill until the number finally dropped and now feels tired and dizzy half the day. Same number on the screen, very different quality of life. The current guidelines still put real weight on the everyday levers, the unglamorous ones that work. The 2025 guideline emphasizes lifestyle changes such as a healthier diet and increased physical activity as a foundation of managing blood pressure. Let me give you the few that move the needle most, in plain terms. Salt. Most of it isn't from your salt shaker. It's hidden in bread, canned soup, deli meat, and restaurant food. Trimming the hidden salt can nudge that top number down for many people. You don't have to eat bland. You have to read labels. Movement, not marathons. A regular walk, even broken into 10-minute pieces after meals, helps keep vessels flexible. Think of your blood vessels like garden hoses. The more supple they stay, the easier the flow. Weight, sleep, and alcohol. Small, steady changes in any of these can each shave a little off the number. None of them alone is magic. Together, they add up. But here's the honest part. For many older adults, lifestyle alone won't get all the way there, and medication is a reasonable, sometimes essential tool. Not a failure, not something to be ashamed of. The goal isn't to avoid pills out of pride. The goal is the right amount, enough to protect your heart and brain, not so much that you're paying for it in dizziness and falls. That balance, that's the real answer to the question in the title. The best blood pressure for older adults isn't a single magic number you chase off a cliff. It's a sensible range, reached gently, matched to your body, and confirmed by readings you can actually trust. Your action. Pick one lifestyle lever this week, just one. The hidden salt is usually the easiest place to start. Master one before adding another. Transition. Let me pull this together into something you can actually use, starting today. So, what's the real truth about the best blood pressure for older adults? Here it is in one breath. The official target for most adults is now under 130/80. But for you, the right number depends on how robust or frail your body is. It has a floor you don't want to crash through, and it only counts if you're measuring it honestly. Here are your steps for this week. Easiest first. Step 1, easiest. Find your recent numbers. If you don't have them, that's your sign to start writing them down. Step 2, do the 1-week home check, twice a day, sitting quietly first, written down. The trend, not the single reading. Step 3, pick one lifestyle lever. Start with hidden salt. Read one label today. Step 4, notice and note any dizziness when you stand. Don't dismiss it, and don't change a pill on your own. Write it down. Step 5, most important. Bring your home readings to your doctor and ask the one question that changes everything. Given my whole health picture, what's the right target for me, personally? One last thought to sit with. For most of our lives, we were taught that managing blood pressure means making a number as small as possible. The deeper truth, the one that takes some living to appreciate, is that the goal was never the number on the screen. It was a long, steady, active life with your feet under you. The number is just one tool for getting there. Don't let the tool become the goal. One last question for you. And honestly, many of you have been managing this longer than I've been explaining it. What's the one thing that's actually worked for you? To keep your blood pressure steady without feeling worse for it? A habit, a food, a routine, something your doctor told you years ago that stuck. Put it in the comments. Your experience is often more useful than anything in a guideline, and someone scrolling tonight needs to read it. Take good care of yourself and that steady, active life. Pause. I'll see you in the next one.